For Wednesday, October 28th, 2020. Dun, 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 dun. This is the Pro and Con Show, and I am your host, as always, Michael James Ott. Welcome to the show. So the purpose of the show, of course, same as it's always been, is to encourage all of us, every single one of us, to be better citizens. And what do I mean by that? Well, to take some time out of our schedule every month. I'm not talking about 40 hours, but I'm probably talking about a handful of hours every month to dedicate to looking at some of the most important issues and actually opening our minds and our ears and our eyes to the possibilities that some of the beliefs that we have and the information that we have isn't either correct or completely accurate or completely full. We may be missing information, and all of us actually almost certainly are. Okay, so today's show is called COVID-19 Update. So I've done these updates every week or a couple weeks as the pandemic has continued. And unfortunately, the news this week is not good. So the pandemic has started to escalate again, the number of cases. So while the amount of testing is increasing in the single digits kinds of things, the actual cases being identified is increasing by 10 times that. So maybe 30% increase, 40% increase versus a 5 or 6% increase in actual testing. And so if the part of that math is when we're doing testing, in the early days of the pandemic, maybe 4% of the people tested positive. Now we're easily up to, in some places like my state of Wisconsin right here, I've seen numbers that are up to even something even close to 30%. Something approaching 30% of the people here in Wisconsin that are now being tested for the novel coronavirus actually are positive. And that's a huge difference compared to just a few months ago. And we still don't have a vaccine. And yes, Mr. Trump promises that he's gonna pull a vaccine out of his back pocket yesterday, but that's not going to happen. And so what we have then is what we should have always been doing, and in fact, we haven't been doing it very well. And that's what's causing, now that we're moving indoors, now that we're spending a lot more time indoors, now that we've been in this isolation or semi-isolation, I think there's a level of fatigue where people are just, kind of tired of sitting alone or sitting apart and, wanting to have more social interaction and stuff like that. And they're now, because of the temperatures outside, they're now doing those things indoors with a population that now has a lot higher percentage of people that are infected. So this is a multiplying factor, and it's causing the rate of infection to increase markedly. And there's a lot of evidence that in the coming days we're probably going to surpass the worst infection rates and stuff. And daily numbers, we're probably going to shoot right through them. And the thing that's true, and was true weeks ago, and many times I've said, the only things that we have as weapons right now is to try to prevent this. Now, there is some treatments, and Mr. Trump got some experimental ones when he was infected that appear to have helped him. But sadly, those are not available to most of us. And so the weapons that we have are wearing a mask and staying away from other people and washing your hands a lot and getting tested. And so if you're either have any symptoms whatsoever, or if you think even if you think you've been around somebody that might have had the coronavirus, you should get a test. Okay, it's a swab up the nose, and the other sad thing is that we only have certain levels of rapid tests, which mostly are being used in the medical industry. I know because I'm getting tested once a week as I work in my job supporting some long-term care and rehab patients in this facility. But testing nonetheless. And then again, if you suspect that you've been around someone that was positive for coronavirus, then stay away from people until you get a test and those test results. And do not have parties. Do not, it's one thing. For example, I a couple of times now, there's a good friend of mine, and he'll come over. He's come over 3 times, and again, we stay apart, in this house. And, we talk and we'll have a beer or whatever and have dinner or something, and we'll just talk and talk and talk, right? As friends do. But we're careful to stay a good distance from each other the whole time. And we, wash our hands and then we're also, at least certainly I am, and I believe he is as well, when we're out in public, we're wearing a mask and we're washing our hands when we get back, or using a hand sanitizer immediately or frequently, all of these things, because those are the tools, those are the weapons that we have at the moment. And the professionals in the healthcare industry, they are absolutely adamant that if we Americans, there's 340 million of us, of course, some of us are too young to do these things for ourselves, but the vast majority of us, 300 million of us anyway, are perfectly capable of staying, apart, being careful not to get in groups of more than just a handful of people ever, especially indoors, wearing masks when we're around anybody and any closeness at all. And then, again, if we suspect, even have the slightest suspicion that we're anywhere near someone that was infected with the coronavirus, we should get tested. And until we get tested, you should take even extra precautions to stay isolated from other people. And again, all of us washing our hands, wearing masks, staying away from each other, getting tested on a pretty frequent basis, again, especially if we have symptoms or if we think we might have been exposed. If we do those things, the rates of infection on a daily basis, which I think right now they're like 70,000 a week or a day. Sorry, 70,000 a day. 70,000 a day. And the death rate, we've gotten better. Some of the treatments in the hospitals definitely is better. So even though the infection rate is, and the number of cases identified every day is quite high, the number of deaths are still high, but not as bad as they would have been had we not learned a lot about convalescent care in the interim. So we have made some progress there, and the percentage of people dying compared to being infected definitely has gone down. But it's still much worse than flu, still a big problem. And because the infection rates, the daily infection numbers could keep climbing, we're definitely going to run out of hospital space at some point and things like that. So again, please, I don't care who you are, where you are in your station in life, the coronavirus does not care. It doesn't not care whether you're rich or poor. It doesn't care whether you're white or black. It doesn't care whether you're a blonde or brunette. It doesn't care whether you're a man or woman. It doesn't care whether you're young or old, in fact. The important thing is you've got to You've got to do these basic things. And my analogy is I live in Wisconsin. Okay, so we have something called winter up here. And nobody likes, I'm wearing a sweatshirt. In fact, it's gotten, chillier, so you put on more clothing. No one likes wearing a mask. No one likes staying apart. No one likes washing your hands or uses hand sanitizer all the time. These are inconveniences that you don't like. Just like if you try to go outside here in the winter, you've got to put on a parka. If the temperatures are cold enough, you put on gloves, you put on boots. It's snowing, it's sleeting, it's windy, it's minus 10 degrees. Well, that's inconvenient. It'd be really nice not to have to do those things. But guess what? Part of our lives right now is to do stuff just similar to the inconveniences of winter here in Wisconsin and Minnesota, this upper Midwest. Those same sort of inconveniences are now true inside our homes, in our shops, in our restaurants, because of the coronavirus. It's just the way that it is. But they're inconveniences. They're inconveniences, and okay, so a lot of us aren't used to them, but you get used to them. You get used to them. People here in, like, say, the Wisconsin, Minnesota. So I lived in the Carolinas for a long time, long time. And then I moved up here to first Minnesota and now Wisconsin. And, when I got here, the winter and everything, people were coming in, and I was amazed, actually, how normal it is. People come into your home and they just kind of strip off all the winter stuff, and it just flops on the floor. This is typical stuff here in this area, because that's just the way it is. You get used to this inconvenience, and you deal with it. You deal with it. And the coronavirus thing with the masks and the distances and washing of hands and getting your test done and all that stuff, that's an inconvenience, but you got to do it. And just like if I go outside in minus 20 degree temperatures and I stay out without a parka, without all the protection for more than a little while, bad things are going to happen to me. So I go through those inconveniences to make sure that I remain healthy. Well, the same thing for this coronavirus. Now I need to do masks and separation and all these things, because even though it's inconvenient, it keeps me and the people around me healthy. Okay? So again, the coronavirus thing is increasing, and it takes diligence on our part to forego or to bear the burden of these inconveniences, and just say, this is it. This is required of me. I'm going to do them, just like putting on a nice heavy winter coat if I'm going to go outside when it's cold. All right. So for the Pro and Con Show, my name is Michael James Ott. Be safe out there. Mask, distance, small groups, sanitize the hands, test like crazy, quarantine if you're positive, all those things, do them. Please, no matter who you are, do them. For the Pro and Con Show, my name is Michael James Ott, and until the next show, bye for now.